Hello everyone. Today we will be talking about giving injections. Injections are a way of administering a sterile liquid form of medication into the tissues of the body beneath the skin, usually using a sharp, hollow needle or tube. This is a parenteral way of giving injections. There are four main types of injections, which are intradermal, subcutaneous, intramuscular, and intravenous. Today, I'll demonstrate three of these types of injections. For the preparation of injections, first we need to ask the consent of the patient. Then we need to prepare necessary materials. These materials are the syringe, the needle, the medication for the injection, sterile cotton, sterile gloves, and apron for the staff to wear. And if you are giving IV, you will need the tourniquet. This is a buccal tourniquet. Now I'm going to show you the parts of a syringe and needle. This is the syringe and this is the needle. This is a protector to cover the needle, so you can remove this. And at the tip, it is called the bevel, and this is the shaft of the needle, and this is the hub of the needle. This is the needle adapter. This is the barrel of the syringe. This is called the plunger. And that's all. So now I will demonstrate the delivery of subcutaneous injection. The site of injections are deltoid region, area around the umbilicus, and medial aspect of the thigh. The site of insertion must be cleaned properly using cotton dipped in antiseptic solution, like such. To hold the skin in the deltoid region, it must be held so that there will be an apex and a base. So it is basically a triangle. You'll be inserting through the base of the triangle, this area. If it's around the umbilicus, a skin fold is taken, and it's the same with the medial aspect of the thigh. For injection purpose, we will be taking a 25 to 27 gauge needle around 5 to 8 inches long. So if this is the deltoid region, the triangle is made, and you'll be infiltrating through the base. The needle is held in such a way that the index finger is below the flash chamber or needle adapter, like this, and the rest of the fingers will be supporting the needle. It's advanced at 45 degrees to the skin. Like this. Once it's inside, this hand will be fixing the syringe, and you can release the other hand and advance the solution. When solution is inside, we can use a sterile cotton on top of the needle and then withdraw the needle. Subcutaneous injections are given, for example, during insulin. You must keep in mind that we must self-date the insulin injection site such that there won't be any atrophy of the subcutaneous tissue. Next, I will demonstrate the delivery of intramuscular injections. Best site of this injection is lateral upper quadrant of gluteus area. This is to prevent the damage to special structures such as sciatic nerve. The needle size is around 2/3 of 5 to 8 of an inch. The position of the patient must be prone position. This is to prevent constriction of the gluteus muscle. In this case, the needle might break if there is excessive force around the muscle. So, the needle is advanced at 90 degrees. At 90 degrees, it is held so that the little finger supports the flash chamber or needle adapter right here, while the index finger is on the plunger and the 3 fingers supports the body. We may even get a gluteal fold, or we may try to create a Z-track by pulling downwards. So if we create a Z-track by pulling downwards, it will be like so. Also remember that the injection site has already been cleaned with antiseptic solution. The needle is advanced at 90 degrees. It's advanced as fast as possible to avoid pain. As you can see, I have left 1/3 of the needle outside. Once it's inside the muscle, we may pull back on the plunger to see if it has hit any capillary or vein. Then if the blood is negative, we may advance the solution. After the solution is advanced, place the cotton and withdraw the needle. Intramuscular injections are given for a quick absorption of delivery material. Next is intravenous injections. Intravenous injections are better than the other 2 injections because we can determine the exact concentration of medication in the blood. Before we begin the process, we must apply a tourniquet to find the position of the vein. So this is a simple way of applying a tourniquet. We can use a buckle tourniquet like this. Place the tourniquet with both clips facing upwards. Upwards like this, and then clip the ends together around the arm. Then place a finger under the clip so the skin isn't pinched. Next, we should pull the end to tighten as such. At this point, we can ask the patient to clench and unclench the fist. This way we can see the dilation of the cubital vein. So we should palpate and then find the position, and then we must clean the area of injection site with antiseptic solution. After cleaning the site of injection, we can ask the patient to again clench and unclench the fist, and then we can fixate the vein to prevent it from moving during the injection. Once it is fixated, we can advance at a 45-degree angle inwards until we see blood in the flash chamber. Once we see blood in the flash chamber, we can make it at an angle of 15 degrees and go parallel to the vein. Once we fix it at this position, we can pull back on the plunger to see if it has hit the vein. If it's so, we can see blood in the aspiration. If it is positive, now we may release the tourniquet by simply pressing on the clip and the button. It's easily released and we can ask the patient to unclench his fist. And now we advance the medication. Once the medication is advanced, we can apply a cotton at the site of the injection, and then we can withdraw the needle and ask the patient to keep his arms bent for a while.